Okay.
Alright, we've gathered our equipment, so we're checking our medication against the order. We have 0.9 sodium chloride.
Okay.
Okay. And then there's no inconsistencies. There's not showing no allergies on the record. The sodium chloride and sodium chloride are compatible. We need to know the actions, the special nursing considerations, the dose ranges, the purpose of the medication, adverse effects, the appropriateness. We've done check we're gonna assess the compatibility of the ordered medication, the diluent, and the infusing IV fluid. It's all compatible. We're gonna perform hand hygiene. We are going to prepare the medicine. We're checking the expiration date. We're confirming that the prescribed infusion rate is necessary. We're gonna scan it. Transport to the bedside carefully, and we're gonna keep an eye on our medications. We're going to identify the patient. What's your name and date of birth? And we're going to compare this information with MAR. It's all accurate. We're going to identify the patient using at least 2 methods. And I checked their armband.
Okay.
So it's alright.
Alright.
We're going to scan the patient's armband. We are completing our necessary assessments before administering medication. We are checking the patient's allergy band.
No allergies.
Do you have any allergies? No allergies. We're explaining the purpose and the action of the medication. You had to have an IV today to get some antibiotics and some fluids. Okay.
You're number 15.
We're gonna check out the IV site to make sure there's no inflammation or infiltration, and then put on our PPE if needed. We're gonna select the appropriate secondary infusion tubing, which we have here. We're gonna open the tubing packaging and close the clamp. Okay, my clamp is closed.
Remove the cap of the tubing spike. Cap on the port of the container. Okay. Okay. Attach infusing tubing to the medication container by inserting the tubing spike. Okay.
And a twisting and pushing from.
Okay. Feel like I'm feeling my fingers.
Okay. Hang piggyback container on IV pole.
When was that going on?
Didn't say when. Oh, don't know.
Oh my gosh. Okay.
So then we're gonna hang the piggyback container on the IV pole, positioning the
Hanger higher.
Just telling you, it needed to be that way.
Okay.
So then we're gonna put a label on the tubing with the date.
Okay.
We are gonna squeeze the retainer and release until half full.
Okay.
We're gonna open the clamp and prime the tubing.
Can you reach out here?
I'm just, I can't reach it. And then we're gonna close the clamp,
Okay.
place the needless connector on the end of the tubing using sterile technique. We're gonna remove the cap of the needless connector and on the infusion injection port. If no cap placed, use antimicrobial swab to the infusion port. Scrub.
Trying to find the English word. Okay.
And we're going to allow it to dry. Then we're going to connect the piggyback setup to the port above the pump.
Okay.
And then we're going to open the secondary tubing, set the rate for the secondary tubing in the IV pipe, and begin infusion. Yes, gravity infusion. We're going to monitor the infusion. We're going to clamp the tubing on the piggyback when infusion is complete. We're going to follow policy procedures. We're going to replace the IV container to the original height.
Is that one?
Okay. And then we're gonna check bold. We're gonna check the primary infusion rate on the pump.
Wait, this is the fall below it. Right? This needs to be up. Here. This needs to be
And then if using gravity infusion, we're gonna readjust the flow rate of the primary IV. We're gonna remove PPE, perform hand hygiene. We're gonna document with the patient response to the medication. The end.